Welcome to Life-Saving Tips, Early Diagnosis of Cancer, brought to you by Maybank and Ethica. In this virtual event, we shall explore a very important subject of discussion. But before we get into talking with our guest from Gleneagles Hospital, allow me first to point out a very scary statistic. 10 million deaths. 10 million deaths in 2020 were caused by cancer. Sadly, that's even more than the deaths caused by the dreaded COVID-19 virus. Now, if we look at this chart, the top 6 cancers show some very familiar names. Breast cancer, lung cancer, and the cancer all men dread, prostate cancer, is up there too. And what's caused this surge in figures? Recently, the health minister, Khairi Jamaluddin, alluded to the fact that Malaysians aren't really very health conscious. We hardly go in for any medical checkups. Checkups that could save us a lot of time and money. See, ladies and gentlemen, the moment someone is diagnosed with cancer, they are already in stage 3 or 4. Very expensive, very difficult to cure cancers. The reason for this? Well, simply because of our own patterns of behavior. And the result is an insurmountable mountain of finance that most people find very difficult to climb. What comes after that are newspaper headlines that we are not unfamiliar with. Family seeks aid to fund cancer treatment. Time and time again we see these headlines, and it has become something of a commonplace in Malaysian life. So ladies and gentlemen, let's explore this topic a little further. Welcome to Life-Saving Tips, Early Diagnosis of Cancer, proudly brought to you by Maybank and Ethica. Early detection makes a significant difference for cancer survival. That's why we've invited our special guest to help shed some light on the signs and symptoms, those early warnings that will make a big difference. Ladies and gentlemen, we have Dr. Warren Lu, consultant urologist from Gleneagles Hospital.
Ladies and gentlemen, I'm Dr. Warren Low, the consultant urologist. I'm honored enough to be invited for this session. Let's talk about the urological problems. So what are the common urological problems that men and women encountered? So if you were to look at this particular picture, now you can see that there are 2 kidneys, followed by the ureter, that's where the urine is drained, into the bladder, and subsequently you have a urinary passage, and this is what we call urethra. And then just before that, there is something called a prostate gland. And you know that the prostate is only there for men, and it's not there for women. So when it comes to urological problem, essentially, it's a disease that covers anywhere from the kidney to the ureter, to the bladder, to the prostate, and of course to the urethra. Prostate cancer is actually very important because I would say in Malaysia it's probably a little bit underdiagnosed and underreported, because breast cancer and cervical cancer is most talked about. But when it comes to the prostate cancer, mostly people do not know where exactly the prostate is. Now the prostate is basically an organ situated right below the bladder. So if you can see from here, this is almost like a walnut shaped organ. So the prostate itself actually has no function. Not much of a function, I wouldn't say totally no. The function of the prostate is basically just to come up with a little bit of a lubrication, so it helps you during the ejaculation, and that's about it. But unfortunately, men are all born with this prostate gland. And what is the function of the prostate gland? Just to give you a bit of lubrication. Now, the problem with the prostate is that it enlarges. Okay, so after 50 years old, you know that the women go into postmenopausal state, but men actually have also a phase called andropause. So when it comes to andropause, there will be a lot of imbalance in the male hormone. We will not go into the phase like postmenopausal woman, because postmenopausal in women meaning to say that their hormones are completely depleted. But because men actually have 2 testicles, the testicle will constantly produce the hormone, and the hormone will keep the man still having a little bit of a hormone inside there. But the fact that the andropause actually cause men to have this prostate enlargement. So every man above 50 years old will have prostate enlargement, like it or not. So the prostate gland is about 20 to 25 grams. But when it comes to enlargement, it can enlarge to many folds. For example, in Asian, most of the time I would see the large prostate so far that I've encountered is probably about 150 to 200 grams. But if I were to look at an Afro-Caribbean patient, they can easily just walk into my clinic and I can assess them and found that they actually have about 500 to 600 grams. So sky is the limit. Okay, so the prostate can grow and it will never cease to grow. So it follows your age. The older you are, the bigger the prostate is. So now, unless you chop off your testicle or remove the testicles, otherwise the prostate will always be enlarged after 50 years old because of the imbalance in the male hormone. Now, what is the problem with the prostate cancer? Prostate cancer, the symptom is very much similar to prostate enlargement. But in Malaysia, I would say in most of the Asian countries, the incidence of prostate cancer is about 10 to 15%. It's not very common, but having said that, it's quite alarming as well. Most of the time, it's actually linked to people who actually have strong family history of prostate cancer or they are chronic smokers. So we know that we need to link a lot of cancer to smoking. So of course, now the advice is do not smoke. Now, when you have problem with the prostate cancer, which can present very similar to a normal prostate enlargement, such as difficulty in passing urine, occasionally passing some blood in the urine, occasionally some blood in the sperm. These are all the common symptoms. And of course, when you have an enlarged prostate, you always feel the need to rush to the toilet, passing urine many times at night, associated with some frequency and urgency. So what happens is that when the patient have this prostate enlargement, it's always very important for us as urologists to rule out whether there's a possibility of prostate cancer or not. Now, how do we go about ruling it out? Number one, you need to go for a tumor marker. That is what we call PSA. So any reading above 4 is very alarming. Now, the other one is to do a digital rectal examination. Now, what is digital rectal examinations? Basically, it's how we examine the prostate. So if you were to look at this, supposing this is a penis, and this is a testicle, and this is a bladder, so you can obviously see that the prostate is an organ situated right below the bladder. So this is a prostate gland. Now, can I examine the prostate from the front? The answer is no. Can I examine the prostate from below? The answer is no. So we have to stick our finger into the back passage, basically through the anus, into the rectum, and we can feel the prostate, not just to find out whether the prostate is enlarged, but at the same time to find out whether it is nodular or hard, suggestive of prostate cancer. So the finger examinations give you about 75% of sensitivity. Likewise for the PSA, which is a tumor marker, also give you another 75% of sensitivity. Now, having said that, having done that, if you have got a PSA which is like more than 4, and the finger examinations are very nodular and hard, what is the next step to do? Get the MRI. The MRI will give us some idea of whether we need to actually pursue the biopsy, because biopsy is pinching out the tissue from the prostate to ultimately confirm the cancer. Now, why do we bother to do the MRI first? Because MRI, once you do the MRI of the prostate, it actually gives you 5 patterns. Pattern number 1 will be very highly unlikely cancer. Pattern number 2 will be unlikely cancer. Pattern number 3 will be equivocal, can be 50-50. Pattern number 4 will be likely, and pattern number 5 will be highly likely. So if you were to talk about pattern number 1 and number 2, meaning to say that it's highly unlikely and unlikely, you probably do not need to pursue the prostate biopsy because you know that this is probably unlikely to be cancer. But if you have any pattern such as pattern 3, pattern 4, and pattern 5, then you would be advised to go for a biopsy, because ultimately the biopsy is the one that confirms the cancer, not just the cancer, also to tell us what type of cancer that you have and whether the cancer is an aggressive type or not. So that is the prostate cancer. So prostate cancer, when it comes to treatment, what do we do? It's divided into 3 stages. Stage 1, as in the prostate cancer stays within the prostate gland. That means to say that the prostate cancer remains within the prostate. So the better thing to do is, of course, to remove the whole prostate, because you get 100% cure and 100% clearance. But if we were to talk about the second stage is as such that the prostate cancer have gone around the prostate gland, then of course the surgery may not do the trick. So what you need to do is to actually go for a radiotherapy, because a radiotherapy is a field change, so they can actually burn everything here. So it still gives you about 80 to 90% of a cure, which is not too bad. But when it comes to stage 3 meaning to say that the cancer would have gone into the bloodstream, and the prostate cancer has the predilection towards the bone, so it loves to go to the bone. So when we talk about the bone, it can encompasses anything from the skull bone down to the toe. So in that case, if you have a bone, if you have a cancer that have gone to the bone, you know that at the back here we have a spine. So if you have multiple cancer deposits onto the spine, and then what will happen is that it will compress onto the spinal cord. And you know that the spinal cord ultimately controls the bladder, the intestine, the erections, and both the legs, and the patient may very well end up with paralysis. And that's the reason why some of the times we get the referral from the orthopedics and the neurologist when the patient presents to them with the paralysis, not because the patient have any other reason. Ultimately, the cause is actually from the prostate cancer, because the prostate cancer has spread to the bone, and it actually compresses onto the spinal cord, and that's the reason why the patient presents with paralysis. So in that case, for third stage, what do we do? Obviously, surgery and radiotherapy may be a little bit too late. So what we do is that we actually give hormonal therapy. So you may be wondering, what is hormonal therapy? You know that the prostate cancer spread very fast because of the male hormone. So you want to suppress the hormone to curb the progression of the cancer. So how do we go about suppressing the male hormone? Number one, you can either go for a 3-monthly injection, meaning to say that you press the testosterone down to a base level, meaning to say as zero, as baseline as possible. Now, the alternative is actually to remove both the testicle, because once you remove both the testicles, you take away the testosterone, which is the main stimulant for prostate cancer. Now, we don't talk about the chemotherapy, because if you were to embark on the hormonal journey, meaning to say that you take on the hormonal treatment, that will last a patient for the longest period of time. And the time whereby the PSA, which is the blood tumor marker, continue to rise after a couple of years, then only we talk about the chemotherapy. So when we talk about the chemotherapy in a prostate cancer, we literally tell the patient that you probably have another 2.5 to 3 years to live. So if I were to give you a plate of cancer, for example, a nasopharyngeal cancer, gastric cancer, stomach cancer, intestinal cancer, prostate cancer, bladder cancer, ask you to choose a cancer to die, you probably want to choose a prostate cancer because it's the best cancer that you ever get, because even without treatment, a person can last about 10 years. All right, so that's so much about the prostate cancer. The commonest things that women suffer from is basically urinary tract infection. So you'll be wondering like, okay, urinary tract infection is such a common disease, so I can just get medication, antibiotics, and that's about it. Maybe there are some herbal things that I can actually try on. Well, the fact is that there are many diseases that present itself like urinary tract infection, but in fact it's not urinary tract infection. Now, what are the things that you might want to think of? So if an elderly woman can come to see me with many attacks of urinary tract infection and being given multiple times of antibiotics, I may really want to investigate a little bit more, because I wouldn't know whether this woman is actually suffering from bladder cancer, because bladder cancer, ultimately, you know there is a mass, and the mass sometimes can slough off the dead tissues, and the tissues can come off as urinary tract infection. So if an elderly woman that comes to me with a frequent urinary tract infection and never really resolved with antibiotics, I would definitely want to rule out whether this is a bladder cancer that we're talking about or not. So this is one thing. And the other thing that women most commonly have is basically the chronic pelvic pain. So we do not know. Sometimes they would mistakenly thinking that they have urinary tract infection. Well, the pelvic pain could be due to many, many other reasons. Now, you can have a painful bladder syndrome. You can also have cancerous things like, for example, a cervical cancer or even an intestinal cancer that presents itself as a chronic pelvic pain. And you would have thought that you actually have the urinary tract infection. In actual fact, you do not have urinary tract infection. You have something which is far more cynical. So coming to the urinary tract infection, how do we treat and how do we diagnose? Number one, women often present. Oh no, why do I keep on mentioning the woman? You have to imagine that the woman, the urinary tract, which is this one, you can see that right below the bladder is the urethra. So the urethra in women is only about 2 to 5 centimeters. So among the Asian lady, most of the time it's only about 2 to 3 centimeters. So you can imagine it's very short. But when it comes to men, the exposed end, which is the penis, about 4 to 5 centimeters. But the inner part, which is hidden inside the body, contribute another 15 centimeters. So add up together, it becomes 20 centimeters. So you're looking at about 2 centimeters in women versus 20 centimeters in men. That's the reason why men seldom complain to you with urinary tract infection, more commonly encountered by women. The other common thing that that the woman will complain is that they often have this burning sensation. They feel that they are not able to empty the bladder. Well, the reason is because once you have urinary tract infection, now once the infection sets in, the whole urethra here is going to be swollen. So the passage becomes very narrow, and that's the reason why you can't empty your bladder properly. Also, at the same time, the bladder, once it's getting infected, what will happen? It actually kind of gets swollen. The wall will get swollen, and then the capacity reduces. So the normal bladder capacity is about 400 mils. So if you end up with a swollen bladder, your capacity can reduce down to about 200 mils. So a lot of people are under the impression that, okay, I have a urinary tract infection, the best thing to do is to drink a lot of water. But you must understand, 1 glass of water come out to about 300 to 350 mils. And your bladder, once you empty the bladder, you have about 400 ml of capacity. So if you were to have a swollen bladder secondary to urinary tract infection, if you were to continue to drink, what will happen? You keep on going to the toilet because you could not store. And at the same time, when you want to go to the toilet, you find that it's so difficult to pee because obviously with a narrow lumen down there, swollen passage, the patient cannot empty the bladder. So they end up suffering. So that is one important thing that you need to know. So do not drink too much water when you have urinary tract infection. You may want to drink water to flush out the normal infection during the time whereby you don't actually have the symptoms, because why women are more prone to get urinary tract infection, I mentioned just now the urethra is a bit short. The other reason is probably because of the fact that you must understand that right below the urinary passage is nothing but vagina, and right behind the vagina is nothing but anus. Now, do we have bacteria in the anus? Yes, men or women have it. But do we treat the bacteria in the anus? The answer is no, because it just lives harmoniously with us. It's a colonizer inside there. But what about vagina? Do you get bacteria? Do you get fungus? Yes, that's the reason why women get white discharge all the time. But you must understand that all these three little lumens are very close to each other. That's the reason why women tend to get infection far more common as compared to men. So now, if you have urinary tract infection and you have all the symptoms that I mentioned earlier on, the better thing to do is to, number one, get a urine test. Because with a urine culture, you will be able to find out what bacteria that you are having. Now, when I mention the urine culture, I'm not talking about the urine analysis. Urine analysis is a little bit different, because urine analysis, you can actually get it done in GP, and then after that you will know the results within 5 to 10 minutes, and sometimes it's just a little dipstick that will give you some report of whether you have bacteria or whether there's a blood indicative of maybe infection. The thing is that the urine analysis will not tell you very specifically what bacteria that you are having, and also whether this antibiotic is suited to your bacteria or not. So most of the time, we will actually send the urine culture. But unfortunately, the urine culture will take up to about 5 to 7 days. And obviously, the reason behind that is because when you send the urine culture to the laboratory, now the laboratory would have to kind of like keep the sample there, and until the bacteria start to grow to adulthood, then we can identify what exactly the bacteria it is. And subsequently, we use different types of antibiotics to try to hit the bacteria, and it's only about a week later then we will know exactly what it is. The problem is that you do not wait till then, because by the time you wait till then, you probably have very severe infection. So most of the time, once we get the urine culture sent off, we will still preemptively give you some antibiotic first. May or may not be the right antibiotic, but it kind of like, you know that the antibiotic have a bit of overlapping effect. So sometimes it will actually dampen down your symptoms. So this is so much about the urinary tract infection, which is very commonly encountered by women. Well, just to wrap everything up, you know that the most important thing that we need to know is to go for a routine medical checkup. The reason is because there are a lot of things which you cannot know and you will not be able to tell, because you would have thought that by going to a certain lab to get some blood tests done, then you would have had everything covered. The fact is that there are many organs that have no tumor marker. I've just named a few just now. For example, the kidney and also the bladder cancer, there's no tumor marker. There's no way that you can use the blood test to actually identify those cancer. So how do we go about doing it? You need to get an ultrasound or even a scope to identify the diseases. So number one. Now, the number two is that a lot of people are actually under the impression that if you were to go for a blood test, and if the blood test is normal, and then it is actually normal, so you don't have to go for any further investigation. That is also another thing which is wrong, because you must understand that, for example, if you were to have an intestinal cancer, you probably will not know. So if you were to go for a blood test, and then the blood test tumor marker for intestinal cancer is normal, you will be very much under the impression that, okay, I don't have to go for a further checkup anymore because the tumor marker for intestine cancer is normal. Well, the truth is that there are three possibilities. Number one, it is really normal. Number two is that it's of a different variant of cancer that doesn't raise the blood test. Number three, it's a poorly differentiated or a very highly aggressive tumor that doesn't raise the blood test. So you have three possibilities. So if I were to have altered bowel habit, for example, before that, my bowel habits are completely normal. Now I start to get constipation, diarrhea, occasional passing a bit of blood in the stool, occasional passing some mucus in the stool. Even though my tumor marker is normal, I would still go for a scope. So that is one thing that I need to tell. And the second thing is that medical checkup is very important, because you know that especially for those people who have very strong family history of certain cancer, you must understand if a person were to have a prostate cancer at the age of maybe about 50 years old, I would probably ask the patient's son to go for a medical checkup at the age of 40, maybe 10 years before. Because you must understand that some of the cancers, like for example, a prostate cancer, is genetically linked. That means to say that if a father was found to have this prostate cancer, then the first degree relatives, either the brothers, the sibling, and also the son and the grandchildren and the future generation, all would stand a chance of getting the prostate cancer. So for prostate cancer, the chance is actually very high. It's about 9 to 11 times higher than the normal population. Same goes to those people who have breast cancer. Then it's very important for you to forewarn your children that they may actually have a chance of getting the breast cancer as well, because all these cancers are family linked, it's genetically linked. So there are some people who say that, can I avoid cancer? Okay, for example, prostate cancer. Can I avoid? What can I do? The truth is that we do not know how the cancer come about, because the kidney cancer can be linked to family history. It also can be linked to consumption of chemical stuff, or when you're dealing with a lot of chemical things, like for example, the petrol, the paint, the hair dye. So all these things are basically chemicals. So it's been linked to that as well. So is there any other causes? Well, smoking. Smoking is linked to many, many cancers. So you must understand that certain cancers are genetically linked, certain cancers are environmental factors, but all in all, we don't really know how the cancer come about. So there's nothing for you to really prevent it. I think the best thing that you can do is probably stop smoking if you're a smoker, because smoking has been linked to many, many cancers. And now, the other thing to do is that, can I actually take any supplements or any, adopt certain kind of a lifestyle to avoid having cancer? Well, the thing is that, as I told you before, that cancer, you do not know the cause. If you have cancer, it's always good to actually forewarn your family member, because they may actually stand a chance of getting cancer. So we have ruled out the environmental factor. We can actually rule out the genetic factor if you were to go for genetic testing. But the important thing is that you still have to go for a medical checkup, all right? So no herbal stuff, no modification of lifestyle or whatever that can actually change the genetic part of it. Have high index of suspicion. If you think that something that has never been there, for example, you never have constipation, you never have blood in the urine, and suddenly you end up with this problem, please go and seek help from the professionals, okay? Because ultimately, what is more important is that we need to find out the root cause of it. We cannot just brush it off. We cannot assume that if you have burning sensation, urgency, frequency, it has to be urinary tract infection. We cannot assume that you have a pelvic pain. It's probably because of the fact that you have painful bladder syndrome. Well, for all you know, you could be having a colorectal cancer, you could be having a cervical cancer. So more important thing is that have high index of suspicions and watch yourself, meaning to say that adopt healthy lifestyle, go for plenty of exercises, avoid taking too oily, too salty, too sweet a diet, and then try to keep yourself on a regular check. For example, go for medical checkup, and also get your blood pressure monitored, get your heart checked, and I think that would be a good way to go. So ladies and gentlemen, this is the end of my talk. So I know that there's a lot of information, basically it's an overall information. So what we need to do now is to seek help early whenever we have problem, and do not just brush it off, because you know that what you want to do is to get down to the root of the problem and then get the treatment early, because some of these diseases are reversible, even cancer. Because if it comes to a terminal stage, unfortunately, we can only prolong your life to a certain extent, but we can't cure you anymore. So thank you very much for listening to the talk.
Thank you, Dr. Warren Liu. Now, ladies and gentlemen, after hearing everything Dr. Warren has to say, I'm sure you're all just a little bit more frightful about the cost of cancer treatment. It can be even scarier for those of you who are the sole breadwinners. You're adding those figures up in your mind right now, thinking children's education fees, nagging bills, on top of the surmountable cancer treatment cost. But what if I told you that for just 2 ringgit a day, which is about the cost of a packet of nasi lemak, you could get yourself 200,000 ringgit worth of protection? Ladies and gentlemen, allow me to introduce you to the Hero 15 and Persona Lady insurance plan, available in both conventional and takaful version, specifically designed to help you with more than accidental death, total permanent disability, and hospitalization due to accident. Allow me to introduce you to the Hero 15 and Takaful Hero 15 plan, which is designed to help you with the cost of male-specific cancers. On top of that, there is also an allowance for your children's education, and also an infertility compassionate allowance. Plus, you'll also be awarded allowances to help you with those higher purchase loans and your credit card costs. To all ladies watching, Persona Lady and Takaful Persona Lady are comprehensive protection plans designed to help you with cancers, crime-related accidents, and losses due to accidents. We're talking about things like snatch theft, kidnapping, which can happen to men too, by the way, and also unauthorized use of credit card, amongst others. Now, for the families watching, there is a family prosperity bonus in store if you deliver twins. I'll be sure to mention this to my newlywed friends watching. If you like what you're hearing so far about these plans, ladies and gentlemen, please do scan this QR code to receive a free quotation. On that note, we thank you all for watching, we thank Dr. Warren for his insights, and we look forward to sharing more information with you from time to time. I'm Terrence, it's been a pleasure hosting this for you. Have a great day ahead, and don't forget, stay protected with Maybank and Etika.